This is EWA Radio, the official podcast of the Education Writers Association, and I'm public editor Emily Richmond. In upstate New York, the COVID-19 pandemic has forced many child care centers to close, and it's a community where affordable options for families were already in short supply. Joining us today is Amy Feiereisel. She's a reporter for NCPR, North Country Public Radio. They're digging deep into the story from just about every angle. Amy, welcome to EWA Radio.
Thanks so much.
Let's start with this. What and where is North Country? I'd like to get a sense of its geography, its business and industry, and its people.
Absolutely. Well, North Country is actually a term that's used across the northern United States. You hear it in Maine and Minnesota and New York. But for us, what it means is kind of like the upper third of New York State. It's very rural. We have a lot of trees. It includes the Adirondack Park, which is 6 million acre state park. It also includes Lake Champlain and the St. Lawrence Valley. There really are more trees than people. Our area is only 4% of New York's total population. So it's a big area. It's a third of the state, but we're serving a pretty small group of people, and it's very rural.
What is the big industry or big business that people work for, or are most of them commuting to bigger places?
We have a couple of small cities, like very small cities, like Watertown, Plattsburgh, and Glens Falls. But most of the area is made up of small, remote hamlets, villages, and towns. The average town is somewhere between 1,000 to 5,000 residents normally. And the big predominant industries really are healthcare, education, tourism, and the military. And then government work, so like state work. And it is one of the issues up here, finding work.
Well, certainly, with the pandemic, it would be tough to find two areas or fields other than education and healthcare that have been hit harder by this pandemic.
That's very true. Yeah.
I want to talk about how this series came about. Was it one story that you realized needed more time and space, or did you map out something bigger from the start?
So kind of how it came to be is starting at the beginning, really back in March, we started trying out Google surveys, which we actually hadn't had that much success with in the past in terms of people answering them. But with people at home and maybe this sort of common experience uniting everyone, we realized we were actually getting a lot of responses. So we used these Google surveys for a lot of different things. We put one out that was just a basic, we called it the COVID-19 survey. That was the first one. But then we started going a little bit more specific. We have one right now going out about the election. We had one about how people felt about the border, anything that we really wanted to find sources on and we wanted to just hear from a larger group of people about. We tried to put one of these out. And I think it was in May or June that we decided that we should really ask people what the heck they were doing for childcare. Like we'd already done a little bit of reporting about how much education had been disrupted, how schools were trying to go online, how kids weren't receiving that education. We have a real issue with broadband in this area. And it was just becoming clearer and clearer that as things were starting to open up a little bit in New York State, that childcare was a huge issue and that we really needed to take a closer look at it. And so we put out this childcare survey, and I think within the first week, we had almost 100 responses. So that gave us a really good place to start. And it was kind of a conscious decision, I think, by the newsroom to set aside some time and energy of our reporters to look at the issue.
This is a big project, and it looks like every reporter in the newsroom contributed to it. How'd you pull that off?
That was really a highlight of this entire experience, actually. The way that it's set up in our newsroom is that we sort of have regional beats. So usually people aren't on an individual beat, but on a region. And then we do have these sort of mini little beats in there. And my mini beat, which has become a bit of a bigger beat, is childcare and education and K through 12 and universities, all of that. So I sort of suggested the survey and I started processing the survey results early on and produced some of those first stories. But what's so great is, especially because of that conversation we had with Lindsay Turner, with the expert, it sort of got not just the series in everyone's mind, but it gave everyone context. I think it made everyone feel comfortable to sort of dive in. And I feel like we've had such a more thorough and rounder series because of it, because you had all of our different reporters coming at it from different angles. We wrote down sort of all of the angles that we heard from the parents and from Turner. And then it was a bit like divvying it up. You say, I can do this. I'm excited about this. I'm excited about that. At the beginning, I think I was producing like probably half the stories. And now, like a month and a half in, the last 3 stories have been from other reporters.
So, a childcare desert, by definition, is a place where there's greater need than there are actual seats for the children. And definitely the North Country region fit that definition. So, you knew that you had that to work from. You said that everyone in the newsroom sort of got involved in this. Tell us why that was important, at least from your perspective.
I think it was important because, first off, childcare is a subject. I hate to say it, but it's not very sexy. It isn't something that gets a ton of attention. And we didn't realize until we started really releasing the stories, but we were starting to dive into these stories a little earlier than even nationally was being done. But the crazy thing is childcare is not just it's not about kids and it's not just about families. It's so much bigger. It's about the entire workforce. It is a workforce issue, and it's a gender equality issue, and it filters out to everything else. And that's what childcare experts and advocates will tell you. They'll say this is so important, and it's shocking that we don't take a closer look at it.
I think this, sadly, is a time where that can really move to the front burner, making that case in terms of researchers and advocates, but also as reporters to help people understand, because maybe for the first time, someone who's not connected to it, who doesn't need to take advantage of childcare for one reason or another in their own lives, is seeing those ripple effects in their own workplace or their neighbors or their local town.
Exactly. I mean, it's a workforce issue, which means it's an employer's issue. And I will say the advocates that I've spoken with and the organizers in this field and in the North Country, they're dismayed. I mean, this in a lot of ways has made what was already difficult and unsupported worse. But one thing that they have a little hope around is the fact that it's getting a bit more attention and is being thrust into the spotlight.
The entire team has covered a lot of angles to this story. I want to pull out a couple of them. One of them was this, I think, a pretty interesting finding that home providers, that is, people who are licensed to provide home care to a relatively small number of children, have weathered this COVID-19 storm better than some of the larger centers, which may have been part of a chain or taking care of a much larger number of students. And it's interesting to me that smaller seem to be more survivable here. Tell us what you learned about that.
That was something that we were actually able to sort of glean from the Child Care Coordinating Council of the North Country, which is this agency that covers about 3 of our counties that we cover. And they track every single child care center and provider in their area. So that was incredibly useful data. And they were able to give us sort of like by the numbers what was happening in each of these counties. And so in Clinton County, I think it was 84 out of 87 home providers had stayed open, even if that was at partial capacity. So some of them weren't at their full capacity, but a home provider at most is only going to provide for up to 16 kids. And often it's 8 when it's just a single person. So you have them largely staying open through the pandemic, maybe even never closing, not even for a day. And then you had centers very dramatically different that I think only around 25% of them were open 3 months into things being shut down. It was both shocking to me, but then when you went a little deeper, it made a lot of sense. The overhead costs for centers are so much higher. And in terms of aid coming through, the centers needed significant aid to stay open. The home providers could have used the aid, have appreciated the aid, but it maybe wasn't a sort of a break the business moment.
So we know that Congress approved some aid through the CARES Act that was supposed to trickle down to the child care industry. But as your reporting found, in a lot of cases, it just wasn't sufficient to meet the need, but also it was quite short term. Explain that.
So this money comes down, right? But then who facilitates it going places? One of those agencies actually was the Child Care Coordinating Council of the North Country. And they received, in the end, I think they ended up distributing around $54,000 in cleaning supplies, and then another chunk of money paying for tuition for kids, well, essentially for essential workers, for their kids. But the way that she explained it to me, Jamie Basilier, who is the executive director, I mean, she spent a couple of months going around, trucking these supplies around, dropping them off, having people pick them up. And it was just such a drop in the bucket. It was helpful, but it could do nothing in terms of actually keeping a center afloat. Because when you go into the economics for a center, they are on these razor-thin budgets to begin with. Every single kid counts. And the pandemic, it did so many things. It made it so that they couldn't take care of as many kids, right? But they needed the same or more staff. So if you're taking care of half the number of kids, but you need twice the staff, and your budget was already balanced really finely, it doesn't make any sense. And a lot of centers have opened to their own financial detriment. And then they also had to do things like they needed to procure a lot of cleaning supplies, and someone had to pay for that. And that was what the CARES money went towards, a lot of that. But you get your 50 gallons of hand sanitizer and then it's gone, and you need to buy more.
I do think it's interesting that you talked about some of the community organizations that are trying to step into this breach. I mean, there's some things you might expect, like the YMCA pivoted to add childcare options for essential workers, but a lot of families were just left to sort of cobble this together. And you write about this sort of DIY, do-it-yourself approach. Can you give us a couple of examples of things that you thought were particularly creative?
Yeah, the DIY approach, I would call it, they were just like, we don't have childcare. We're not going to be able to find childcare, and we're going to have to do it ourselves. So I think a lot of families are juggling that, where parents are taking turns, they're switching off hours, older kids are taking care of younger kids. I also spoke to families who, because actually childcare is so hard to find right now, they're also sort of cobbling together even providers. They have their kid going to one person in the morning and someone else in the afternoon. And a lot of the time it isn't a provider, it's a neighbor or a family member. Family members taking care of kids was a really big sector. And then we did a look into kind of the idea of potting up, and we found a couple of different examples, and they've come a little bit out of the woodwork even since then, of families who've basically decided, I'm only going to see you and you're only going to see me, and we're going to try and split our childcare responsibilities as best we can. And we saw that both with families who had similar low risk levels, like everyone works from home, we feel pretty comfortable getting our kids together, and also social pods of people with high risk levels. So essential workers saying, hey, we're all at the same risk level anyway, and we desperately need help, so we're going to help each other.
We're talking with NCPR reporter Amy Feiereisel about the childcare shortage in upstate New York. Don't miss an episode of EWA Radio. You never have to. You can find us on your favorite podcast app. And thank you to everyone who has taken a moment to rate us on iTunes. Your support and your feedback are helping us grow. Amy, I'm interested. You got the whole newsroom on board, and that seemed like a great step forward. But I'm interested in, what were some of the roadblocks that you hit on this series, and how did you overcome them?
An initial roadblock was, we knew we wanted to do this childcare series, and now we had all these parents, to talk to or available because they'd answered our survey. But it was a little hard to know even where to begin. And this was pretty significant. Only one person in our newsroom was a parent. And so you have 6, 7 people looking at this without kind of that insider knowledge. And I think at the beginning, we were a little nervous that we were going to miss something, right? That we just weren't going to understand, or we were going to be covering something maybe that seemed important to us, but that wasn't actually important to families. And so I think how we tried to address that was really early on, with really no agenda and no story in mind. I just called a lot of people who had responded to the survey, and I just talked to them, and I asked them what they were struggling with and what they were seeing, trends that they thought were emerging, and sort of wrote all of those things down. And then we had this great moment where Lindsay Turner, who's the executive director of the Birth to 3 Alliance in the Adirondacks, actually came onto one of our morning news meeting calls and just fielded questions from us for like 30, 45 minutes. And we asked her too. We said, what is important? What have you been seeing over the last couple of years that you've been doing this work before the pandemic hit? What are you seeing now? What should we be paying attention to? It was really nice to cross-reference actually what someone who worked in the field was thinking about with what we had heard from parents. And some of those things we could have guessed at, but some of them were really a surprise. And then we were happy to sort of follow that lead.
When you talk to these providers, in addition to the families, I'm curious, what's keeping them up at night? What are their big worries about this gap in services for children and families?
Oh gosh, there's so many. um, Jamie Basilier, who, kind of her work for the last couple of decades has been trying to support new centers and new providers getting open. She's been witnessing in real time for the last couple of years the child desert becomes more of a desert as more and more places close, as you go to, instead of maybe one spot for every 5 kids, it being one spot for every 6 kids. And I think that that's already been something that's really worrying her. And she's just worried that at the end of this, there'll be no childcare left, or that there'll be even less than there was to start with. I think the providers themselves, especially the centers, they are so tired. They are so burned out. A lot of them are running at deficits. It's also the profession of childcare, and this is something we heard from provider after provider after provider, just isn't valued, not just from a monetary standpoint, but in wider society. It's also really hard to keep people, especially in that pre-primary school space. A lot of people start with early childcare and then they move to working for a school district because they get paid something closer to a living wage. So, I think the fear is that we won't have childcare options at the end of this. And then the providers themselves, they're tired. I think in a lot of them, some have said to me, I'm ready to throw in the towel. I can't do this anymore. It's not worth it. And also, I think they're feeling a lot of frustration, which Kristen Gillibrand, the New York senator, I think has done a good job in articulating in her push for more support for childcare. But there's a lot of frustration that during the pandemic, I've heard providers call themselves like, we're the guinea pigs. We're just the guinea pigs, like schools got a summer to try and figure out how they were going to do this safely. We got no time at all. We just had to figure it out on the fly. We're dealing with changing regulations day to day, both from the CDC, from the state, and trying to make all of that work and trying to financially make it work too. It's just, there's so many angles that they're struggling with.
Well, when we're talking about doing things on the fly, you've had to really bury yourself in a brand new beat. You started covering childcare in April, is that right?
Yeah.
So I'm curious, what has surprised you about that as you've sort of become immersed in this world and its challenges?
It was diving into both this world, but also into general reporting in a way that I hadn't before. I would say in the past, I was kind of sort of like a hard features reporter. And I ran this project that a lot of the time dealt with oral history and dealt with stories that had kind of already happened. So diving into it, I was like, okay, now I live in the present. I'm not doing these like long oral histories. I'm actually trying to become a quasi-expert, or at least know what the experts think, and be able to sort of synthesize that and say that in a way that is accessible for our listeners, and do it in the sort of new from home world. So not getting to go out and actually talk to people, which I'm really used to doing normally. I spend a lot of the time on the road in the before world. So it's been a really steep learning curve. But what was really neat was almost every quote unquote beat, I think you end up in a little ecosystem. And I think for me, to be able to faithfully and honestly and thoroughly report on this, I had to ask myself to become, a quasi-expert and just talk to as many people as possible. Talk to as many people as possible. At the end of every phone call, I would say, thank you so much. And who should I talk to understand this better? And when every recommendation from someone at the end of a call was someone that I already had talked to or was planning to talk to, I knew I was on the right track. I knew that, maybe I'd talked to enough people.
There are a lot of reporters out there who are either covering childcare or expecting this to be part of their beat going into the fall, and as you said, likely well beyond that. What are a couple of story ideas for them?
I think like start small. And that's kind of what we did with the series. We basically said, we're going to do a series. And then we just started making things. And we didn't have to start with the biggest stories, the stories that would explain everything. We just wanted to get voices on the air and perspectives on the air and stories on the air and try to start reflecting what was going on around us. So I think just try to reflect what's happening, talk to an individual family, talk to an individual teacher, and just ask them what they have been seeing, what they have been experiencing. And then I think that'll point you towards the next story, which might be bigger, and to the next one and to the next one.
I would say also reporters should be thinking about just starting where you started, and that's with an online survey, because for better or for worse, that's how we're communicating with a lot of people these days. And I also feel people might be more receptive to it than they would have been pre-pandemic.
Very much so. I think everyone is a bit more savvy on their computers, but it's also, for a lot of us now, the primary way we communicate. We were shocked how many people were responding to these surveys compared to surveys we'd put out in the past.
What's the outlook right now for childcare in your region? I'm curious what the next stories are going to be in the series. Can you give us a little hint?
From the beginning, childcare has been wrapped up in education, but that is even more true right now. I think there was this big question mark, will schools open at all? And if they do open, is it going to be on these staggered schedules? And the answer was yes, that, the schools opened, but kids are only going to school for 2 or 3 days a week, most of them for 2. And that is such a huge challenge. I mean, it's a huge challenge. We reported early on in the series that if kids weren't going to school, there was no amount of childcare. There was no amount of YMCA programs that would be able to fill that hole. So I think we're actually looking at the fabric of the way people take care of their kids changing entirely, at least for the next couple of months, possibly for longer. Our latest story in the series was actually about how it's mostly women who are staying home and taking care of the kids, and that childcare always made it hard for women's careers. Now it's harder, and it's mom who's staying home. We've talked to so many people who it just doesn't financially make sense for them to try to go to work, and they just can't. They have small children at home. And I think we're going to see the bigger ripple effects of that. The next story after this is actually sort of a deeper look at what government kind of responsibility is for supporting families and childcare, and why that's going to be important when it comes to getting the workforce back on its feet.
I used to be a beat reporter, and when I would talk to kindergarten teachers, they used to tell me they could always tell which kids had been at a really high-quality preschool, because when they would come into the room, they would notice it in the mat on a circle. And also they did things like they could hold a book and turn the pages in consecutive order, even if they weren't necessarily reading or letters or identifying colors yet. And I think it's going to be kind of interesting and maybe a little heartbreaking as we get a few years past this, to see if there are some measurable effects on these kids who are 0 to 3, who are going to be, the kindergartners 3 years from now.
Absolutely. Absolutely. One thing that comes to mind is that I didn't mention earlier when it comes to those fears is Jamie Basilier from the Child Care Coordinating Council. One of her fears was no childcare. Mom and dad are trying to take care of it all. Her fear was that it'll just lead to an uptick in child abuse and neglect. We are already seeing upticks in that from everyone staying at home and not having the opportunity to to get away from each other. You can't escape. And we're surely going to see impacts from this time on everyone, adults and children alike. But children, especially in these first couple of years, these are the years. These years mean a lot, and they do have impacts for the rest of your life.
Amy Feiereisel is a reporter with NCPR, North Country Public Radio. Amy, it's been a pleasure to have you here on the podcast. We appreciate you making the time for EWA Radio.
Thank you so much.
And that wraps up another episode for us. If there's a story or a reporter you want to learn more about, drop us a line at radio@ewa.org. The mission of the Education Writers Association is to strengthen the community of education journalists and improve the quality of education coverage. For more than 70 years, EWA has helped reporters get the story right. Have a great week, take care of yourselves, and thank you for listening.